In the blink of an eye, life can change. It may be a car crash, sports accident, or it may be something as simple as falling out of bed, but it is never expected. Brain injury is a sudden, life-altering event that affects every area of a person's life. Functions such as thinking, as well as social, emotional, and physical aspects of daily life can be affected. Some of these effects can be long-lasting, requiring lifelong care, while others may experience mild symptoms and return to all of their daily activities. Unfortunately, it is impossible to predict what the outcome of a brain injury will be. However, early treatment is considered key to ensuring the best possible recovery. The amount of recovery depends on how severe the injury was. Recovery may include any or all of the above illustrated steps in the continuum. Thanks to recent advances in medical science, we now have a greater understanding of brain tissue and its remarkable capacity to repair itself. It is thought that through rehabilitation, the surviving brain tissue from a brain injury has the capacity to rewire itself to perform some functions of destroyed cells. Depending on the severity of the brain injury, rehabilitation can begin as early as intensive care. Here, it is important to designate a family member or friend to be a key contact with the healthcare team right from the start.
There's a comprehensive healthcare team that helps you and your loved ones through this process. It's comprised of therapists, physicians, nurses, social workers, as well as psychologists that can help you and your family members through this recovery process.
In the early weeks following a brain injury, swelling, bleeding, or changes in brain chemistry often affect the function of healthy brain tissue. The injured person's eyes may remain closed, and the person may not show signs of awareness. As swelling decreases and blood flow improves, so too does brain function. With time, the person's eyes may open, the sleep-wake cycles may begin, and the injured person may start to respond to family members or speak. When the need for medical monitoring equipment lessens, the patient can be transferred to an acute care unit for further observation. Moving out of the ICU can be a scary time for families because it means a higher patient-to-staff ratio and the absence of much of the medical monitoring equipment you are accustomed to seeing.
So in acute care, therapy is centered around making sure the patient is safe, making sure that they're orientated to their surroundings, making sure that they and their loved ones are aware of their prognosis and their recovery, and educating the entire team as to how best to help this individual recover.
As thinking skills and physical abilities progress, the rehabilitation focus shifts to improving attention span, mobility, and increasing independence and self-care. The person may now participate in range of motion or strengthening exercises. The type and amount of rehabilitation therapy allowed will depend on a number of factors, including the patient's severity of injury and level of function.
Inconsistent behavior can be common during this stage. Sometimes the patient might have outbursts. They might not be aware of where they are or who they are or what they're doing. And then other days they may be more orientated and have a better awareness of who their loved ones are around them and their name and where they are that day.
Once medically stable, the person may be discharged home if no further therapy is required. However, in some cases, some patients may require transfer to an inpatient rehabilitation unit where intensive rehabilitation begins. Here, the person will stay overnight and attend therapies during the day. There may still be some medical issues to take care of, but the person will be stable enough to participate in active therapy. On this unit, there is an expectation that the person will be learning how to help themselves and eventually to live outside of the hospital. For this reason, Staff may facilitate activities to help improve independence, such as asking the person to keep their own schedule or get ready for the day ahead.
So families are encouraged to participate in therapies. It's a very important part of that patient's recovery. However, sometimes therapists and staff may limit the number of individuals or loved ones that are involved in their therapy sessions because it can be quite distracting for the patient if there's too many people there for those therapy sessions.
Once the person is able and ready to return home, they may still be referred for further outpatient therapy. Rehabilitation goals to improve physical, cognitive, communication, and mood function will be targeted in clinic, home, and community settings in order to help the person return to day-to-day activities. If the person is to return to work or school, outpatient therapy is a time where many people will work on the skills required to return to these activities. During this stage of recovery, it can be normal for the person to experience fatigue or mood changes as they adjust to returning to everyday life. The goal of rehab is to enable the person to be as independent as possible while ensuring the safety of themselves and others. Ask the healthcare team to teach you what types of activities can be done with your loved one to help participate in their rehabilitation. Therapy also includes helping family learn how to best support further recovery. For a person who was very independent prior to the injury, the change can be hard to deal with. In some cases, the person may not have the awareness or insight to see themselves as having any of these limitations. Family members may need to do many of the tasks that were previously done by the person with the injury. The healthcare team can recommend ways to help while still allowing the injured person to be as independent as possible. Because brain injury affects the whole family, it is important that family members also look after themselves and their own needs. Healthcare professionals, such as social workers, are an important source of information and support to both the injured person and family. Seeking appropriate community-based social support can be very helpful. It can be common for family members to attend brain injury support groups and connect with others who understand the challenges brought on by a brain injury. Each brain injury is different, so it is important to understand that rehabilitation and recovery is a process that can take weeks, months, and even years. The person with a brain injury spends only a small portion of their day in therapy and with the healthcare team. What happens during the rest of the day with friends and family can make a big difference in the road to recovery. Remember that the key to rehabilitation and recovery is practice, and the healthcare team is available to support you in any way they can.